Hello, my friends. Welcome to another case discussion. This is Bruno Leitão from Portugal. And today I'd like to present to you and discuss with you how to deal with fractured implants using the 911 kit from Megagen. This is a problem that we get in our office. Thank God it's a rare problem, but the truth is it happens, and it can be really difficult to deal with. Because if you get this kind of fracture that you see here in this image, there is really no other option but to remove the implant. And it can be quite tricky to approach this situation on a private clinical setting when the patient does not understand that this is the only option we have. This is the scenario we will face if we get this kind of situations. So this lady here had two implants placed on both upper central incisors maybe 7 years ago. She came to us with the crowns were getting loose, and when we removed the crowns, and they were individual crowns, both implants were fractured, and you can see perfectly the platform fracture in this of this implant. And of course, the only option is this: is to remove the implants. We don't have any other option. And in the case of this lady, she wouldn't go through another implant surgery. She lost faith in dental implants, and the solution in this case was a conventional fixed prosthetics using adjacent tooth as support. So when we lose an implant like this, we can also lose a patient, and this is a true headache, and dealing with it can be quite difficult for all of us. So I'd like to present to you this case. Both the pictures and the x-rays were taken 10 years ago. I placed those implants 10 years ago. And back then I was using a different kind of system that you saw in the image before. I was using a 3-channel type of platform. In this case, the rehabilitation was using PFM and UCLAs. You can already think of the problem. So, this patient came to me with repeated crown loosening and marginal bone loss. When we removed the crown on the upper premolar that you can see here in the picture, it was quite clear that there was a fracture on the platform. Using visual inspection, you don't need to have loops or anything. You can see it from a mile away. And of course with the x-ray that I'll show you a little bit later. If we think on how this case was made, we can see the path to failure. So this was a 3.5 millimeter wide implant with a 3-channel connection. We now know that this 3-channel connection is weak, especially when the titanium is thinner. And to make things worse, the fixed prosthetic was done using a UCLA. And the cherry on top of the cake is that the patient has a strong bite. He has that kind of bites that when you ask him to bite, you hear the sound, it's really loud. So this was the perfect storm waiting to happen. And this is the x-ray where we can easily see the marginal bone loss, and we can easily know the platform fracture. So I like to use this 911 kit from Megagen because it's a universal kit. It can be used to remove any kind of implants. Not only implants, but also abutments and screws. We'll focus on the implant on the fixture removal. So, the first thing you need to select is the Torx driver, and you select it according to the vertical height you need to reach the implant platform and the next component. And the next component is this fixture removal screw. To select this, you must select the correct width of the prosthetic screw. It is critical that you select exactly the same width of the prosthetic screw as the implant you're about to remove. Because then you will screw this fixture remover onto your implant in a clockwise direction using the torque wrench. This torque wrench can reach really high torque numbers, and you will over torque this fixture remover with using this torque wrench. And you should really over torque it because it will have to withstand the counterclockwise movement that you will use with this fixture removal that you see up on the screen. And this fixture remover will engage the previous remover on a counterclockwise position. And when you, with your hand, cannot go any further, you just use again the torque wrench and you over torque it counterclockwise until the implant starts to move and can be removed. There is a video from Megagen on YouTube that you can see with the animation of the process, and you can also see it in these images. So on image 2 you see the clockwise positioning of the fixture removal and you over torque it. Then you select the counterclockwise fixture removal and you just unscrew the set of the implant and the first fixture removal you installed. Like this. So, picking up in another case, this patient came to us. This is not my implant, thank God. And of course we need to remove this implant to start all over again. And it's easy to see because the implant is exposed that this implant is placed way too buccally. So the first thing is to remove the crown. So we search for it using a burr, we identify it, unscrew, and we have the implant. Funny enough, it's also a 3-channel implant. So we install our fixture removal, we connect the Torx drive, and we over torque this fixture removal. Then we install the counterclockwise fixture removal and just go counterclock until the implant starts to turn and we can remove it. And you see here, we remove it, and this is the end image of success on removing the implant. And you can see with an intraoral picture that we haven't destroyed anything. We haven't destroyed any bone, we just removed our implant. And this is what we want, to preserve the maximum amount of bone and soft tissues around the implant. And then we can go and place our immediate implant if we want. On the left you can see the beginning of the situation, and on the right you can see any ridge in place with a provisional crown in place. So back to our case. On the right you can see again the X-ray, and it seems clear that we need to remove this implant, and if we use some atraumatic option and not the Treffin, for example, we'll be able to remove the implant and probably just place another implant and approach it as if it was an immediate implant, a conventional immediate implant after an extraction. It's quite similar. And this is exactly what happened. You see here a detailed picture of the implant removed, you can see perfectly where the platform was broken and the implant wall was broken, and you can see how this fixture removal engages the implant and makes it go counterclockwise and turn. We can see here the marginal bone loss that usually goes up to the level where the fracture is. It reminds me of a broken tooth with a vertical fracture. It's exactly the same what happens. And you can see the implant after removal. And clinically, you can see on the left that immediately after removal of the fractured implant, we have our drilling almost done. In this case, I decided to place it a little bit more to the palatal, so I corrected the drilling and I placed a little bit wider implant, any reach 4 millimeters wide. And this is the case finished. After we remove the implant, it's exactly as any other case. Because by removing the implant in such a way, we preserve everything around. So a difficult case can be solved in a predictable way in 20 minutes or so. And this is the case finished with amazing bone response and also soft tissue response. My friends, this was a short video on a particular subject about this kit and about the removal of this kind of fractured implants. I find that if the prosthetic screw hole is intact, you'll always be able to remove it using this kit. So keep safe, keep smiling, feel free to contact me if you need, and make sure you visit the Magagen homepage for more cases from my fellow Minek Knights at imagagen.com. Bye bye.